So the next panel, I'm very excited about. It's going to be very interactive. And the reason why I'm excited is that it's an early career panel, so it applies to pretty much everybody here. And, I feel like especially when we're going through medical school, residency, fellowship, we don't have a lot of guidance and structure on what our options are next. We're mostly reliant on the match system to, determine our fate. And then we're kind of just released into the real world. And there's actually a lot of options, which I think many are not aware of until you're out in the real world. And this panel is for very talented and distinguished speakers. They're all young physicians, meaning they're all within 10 years of finishing training, and they're all doing very different and very interesting and exciting things. And believe it or not, it's really important that we learn, in addition to advocacy, that we really learn the business of medicine. While it doesn't seem it would have an impact on patient care, it actually really does. There's a lot of studies that show physician autonomy actually improves patient outcomes. Physicians are the best equipped, just like they are in Congress, to advocate for patients, but also in the clinical setting. And by having physicians take the lead and physician-led care really helps our patients too. So that's why this is really important. So I'm going to start out by introducing our panelists. I have a few questions prepared for them, but then after that, I would like to open it up to all of you to ask them questions, learn from their experience, and hopefully it will inspire you. We had a panel a couple years ago led by Dr. Choi, and that focused mostly on private practice, but it was very popular, and I think kind of expanding it to other realms will only be beneficial. So I'll go through and speak about our four panelists. So our first panelist, Dr. Daniel Choi, he's a founder and owner of Spine Medicine and Surgery of Long Island, and he's a board certified orthopedic surgeon. Many of you already know him. He's very, very involved in MISNI as well as the AMA, very strong patient advocate. I'll let him speak a little more to everything he does. Our next panelist is Dr. Dan Inder Sraow. He's also founder and president of a Sunstate Cardiology, and he's director of structural heart at Dignity Health, Chandler Regional Medical Center. And he's immediate past national co-chair of structural heart for the Common Spirit Health System nationally. And then we also have Dr. Jocelyn Young. She's Assistant Designated Institutional Officer of United Health Services Hospital in Binghamton. And she'll speak a lot to her role as an in academics, as a clinician, and as an educator as well. And we have Dr. Sheneen Lalani, who is a full-time Locum Tenens physician. She's an internal medicine hospitalist, as well as she specialized in palliative care and hospice medicine. And she'll also speak to, being a locums physician, an independent contractor, and what that looks like. So we're going to get started. I'm going to go around and, ask each panelist the question. And if the other panelists have something to add, as I know there's a lot of overlap, please feel free to do so. So I'll start with Dr. Young. Dr. Young, what made you decide to pursue a career in academics? And when one decides, how do you go about in doing so?
Sure. Thanks, Dr. Parikh. So I'm a family medicine physician. And so I would consider myself an academic family physician. And I decided on that path pretty early in my career. I've always had an interest in teaching. I've always said that if I didn't go into medicine, I would have just gone into teaching itself. So it was a pretty natural fit for me. But as I went through my training, I was really inspired by the teachers who taught me. And I really started to see how it's one thing to have a good relationship and a continuity with my patients and to really affect their life. But by being an educator and really taking academics to be my career, I would be able to help grow future family physicians and really have an impact much wider than just what I could do as like a solo practitioner. So I really love educating. I really love pedagogy and adult learning theory and how can we better educate people so that they retain information. But also I really enjoy training the future family physicians who are going to stay hopefully in upstate New York, or go serve their own community wherever they are. And I would say that to pursue a career like that, there's a lot of different pathways. I did end up earning a master's in health professions education, but that's certainly not a requirement for anybody that wants to pursue academics. Honestly, in pretty much every specialty, there's people needed to be teachers, and you can do it right out of training if that's something that you're interested in. And other people will go and have a few years of a career and really feel like they have built their built their expertise out more, and then they'll start taking on some academics from there as well. So you can pursue extra training, or you can just kind of jump in feet first and go from there.
Great, thank you. So the next question I have is actually for Dr. Choi. Dr. Choi, you decided to open your own solo private practice fairly recently. What made you decide to do so?
Great, thanks, Purvi, and thanks for organizing this panel. Brings me back to pre-pandemic 2019, where we were bumping elbows. Many of us in this on this panel and also in this room are probably at that event. I think James was there for sure. But yes, I mean, since then, during the COVID pandemic in 2020, I actually ended up leaving my large group orthopedic practice, which is still a private practice, but I was employed by the private practice, and I started my own solo practice. And so it's been a huge learning curve. I would say that the main reason to pursue independent practice or even solo practice is for the autonomy. And autonomy means so much, I think, as a professional, as a physician. I think that there is a huge groundswell of burnout. And I think that within physician communities, especially among younger physicians, and unfortunately, I think that many of the younger students on this call, as well as residents and fellows, are probably going to start seeing the effects of that in their training. And sometimes you're in residency programs where you might be competing for training opportunities now with physician assistants, and that's all kind of all of these effects that you see where physicians are being burned out and administrators are kind of running our healthcare system, and it's all about, unfortunately, the dollar, right? And it's about maximizing revenue in our healthcare system because of the corporatization of healthcare in this country. You see a huge amount of healthcare consolidation, like beyond anything I ever experienced in my training. And I'm 5 years in practice, and when I was a resident and when I was a medical student over at Northwestern, there was just no such thing as physician assistants. There were a few, but now physician assistants are being hired in large reason because they're cheaper. They're cheaper labor. Nurse practitioners are being hired to provide care. That's just one kind of symptom that I think affects medical student training, but one symptom of a huge problem that is kind of putting profits over patients. And what that really does is when administrators are making decisions instead of physicians who should really be leading the care team and really be, we know what's best for the patients. And we also, some of us will render decisions based on, looking at revenue and whatnot, but we always put the patient first, right? Our oath is to the patient first. And I see a ton of burnout. And I'm actually right now at a spine surgery conference, and I'm speaking to younger surgeons a lot. I'm asking them, and the bulk of trainees will actually enter into employment options that are health system based, right? That wasn't the case 10 years ago. Like when Purvi and Jocelyn and I were actually looking at job options, probably it wasn't like 80% of the options out there was health systems and employment, that you had private practice hiring. Private practice is shrinking in this country, and our job options are getting limited. And I think that the loss, what the common theme that I hear amongst young physicians, and even my physician spouse who ended up resigning her hospital system position two months ago, so I know very personally how this can affect physicians, is that there is so much loss of autonomy, and that is what drives burnout. I think is the fact that you go to work and you have non-physicians who are telling you, who do not have any medical training, who have not gone through your 10 to 14 years of post-college education, who are telling you now how you should run your clinic, how you should run, you know, how many RVUs you need to generate a year to be valuable to the system. And these are very worrying trends, in my opinion. And I think that to protect my autonomy, the only way I will not have trained 14 years to, you know, I could not handle that, right? I'd rather not practice medicine than go to work every day and be worried that my decisions are gonna be dictated by someone who doesn't have my patient's best interest. So I think that was my main reason to go into solo practice.
Yeah, I think that that fear of, or that feeling of not having control over what you're doing, how you're taking care of people is one of the main factors driving burnout. So I would agree with that. My next question is for Dr. Lalani. Locums has become a trendy option to still work inpatient within a hospital system, yet maintain physician autonomy. Can you explain what your work entails?
Sure. Hi, thank you so much for having me. It's great to be here and it's great to see familiar faces again. So just to kind of explain to you what a locum physician is basically a physician that goes to hospital where there's a shortage of doctors. So let's say if someone emergently went on maternity leave or someone quit, as a lot of physicians are quitting their job because they're unhappy with the patient census or they're moving, you know, a lot of physicians are now not staying at one positions forever. So when they want to fill that spot emergently, they hire these companies that hire people like me, locum doctors, that go to these hospitals to fill that shortage. So the contract can be anywhere for a couple of months to a year, but you're basically filling the spot till they hire someone more permanent. So different companies have different contracts with different hospitals. So you can do locums anywhere. So I do majority of my locum jobs in New York City, but there are locum physicians all over the country. So you can go to anywhere in the US and actually also internationally where there's a shortage of doctors. So I've done locums here, I've done locums in Missouri, I'm gonna do locums in Texas. So all these companies have different hospitals that need physicians to just come in and work. So you can do locums in any field. I do mine as a hospitalist and palliative care doctor, but you can do, you know, GI locums, you can do cardiology locums, you could do surgery locums. So there's not one specialty that uses it, most specialties use it. So the best way to do locums is to be credentialed at several facilities that give you the dates they need help with. So you work with different companies that, you know, bring all these hospitals to you and they say, hey, this hospital needs help these months, this hospital needs help these months. And so what happens is that I create my own schedule. So what I say is like, I want to work 2 weeks straight, and then I don't want to work for 3 weeks. So I pick hospitals that need dates, match them, and, you know, create my own schedule, which is very convenient because right now in my life, I am really taking a lot of interest in traveling internationally. So it's nice to be able to work 2 to 3 weeks straight and then take like a month off if needed. So again, I think the reason I love doing locums, again, is like that Dr. Choi says, is the autonomy aspect of things, being in control of when I work. If I don't like a place or if I feel like they're, you know, if it's malignant, then I can just decide not to go back. You know, I am not tied to them. It's kind of like, you know, dating, like you know, you can be with someone for a little bit. If things don't work, you can say, I don't want to come back, because there's no long-term contract. So it's a really good option, especially if, let's say, you want to check out a facility or if you want to check out a state. So let's say if I decide I want to move to California, but I'm not sure how the medicine is practiced there, I can do locums there, work there for a couple of weeks, work there 1 week every other month, see how things are. And if I like it, I can decide to stay there, or I can say that this is just not working.
Right, that's great. And it's great to have that flexibility as well.
Right.
My next question along the same theme is for Dr. Sraow. So what made you decide to open an ambulatory surgical center, that's purely physician owned? And why do you think it's important, for physicians to have that autonomy?
Yes, thank you. So can you hear me okay? I had to switch to my phone. Okay, so well, before I address that, I think that the points that were already made, I'd like to comment on about the autonomy, which is so important. But on top of autonomy, and I think I have a kind of unique position because I do run a private practice, but I hold multiple administrative roles in the healthcare system. So I really see things on both sides, and I deal with employment contracts for the health system and my own private practice contracts. So one thing that beyond autonomy that's important is security. So job security, and to kind of what Dr. Choi's point was about this drive, this burnout, because you're consistently worried about meeting your RVU target. And the way that works many times in the employed model in the healthcare system is you have this projected RVU model with a bonus structure, but then it continually raises the bar. So if you're very productive, then that actually target will go up, and you'll be chasing this carrot, and you'll continue to have to work harder and harder and harder. And some of the systems that are pretty corporatized, like that I've worked in, like Cleveland Clinic, for example, people are concerned about job security because they create a lot of these healthcare systems to be physicians to be somewhat like cogs in the machine. That purposefully in positions that are easily replaceable. So I think on top of autonomy, which is extremely important for just your overall psyche for such a stressful job, I think job security is important in any position. And when you feel that someone has continual power over you to replace you, I think that drives you to kind of burn out. So that's just one point. But in terms of opening up my own surgical center, so that is like a multitude of things. It's a fairly big undertaking, but very, very well rewarding. One, you just can provide better care because when you're tying up a lot of bureaucracy, red tape, which gets in between the people caring for the patients, the ones that are really the physicians emotionally invested in the patients doing well and feeling well, and a lot of kind of non-physician in-betweens to the actual delivery of care, a lot gets lost. So what you'll see in surgical centers is that as a result, the physician autonomy is increased in the ambulatory space because you're directly dealing with the patient. As a result of that, the patient satisfaction is also greatly increased, and the efficiency of getting things done. If a patient needs something, then you basically have the opportunity to provide it for them. The other thing, if we're talking on like a macro level of kind of the crisis that we have in healthcare about trying to make things more cost effective, by eliminating all those go-betweens in between the delivery of care to the patient from the person actually providing the care, it makes it much cheaper. So for the majority of my procedures, which I do many in the hospital, many in the outpatient settings, for the exact same thing with the exact same equipment, with the exact same result, in an ambulatory surgical center, it would be sometimes 1/4 to 1/6 of the overall cost to the insurance company and to the healthcare system. So actually there's been, as a result of this, just through the economics of it, a big drive out of the hospital and into ambulatory surgical centers. So there are healthcare systems that are doing it, but I believe the ones that are run by physicians are providing more efficient and effective care because we're just more emotionally invested in it as a means to deliver medicine and deliver treatment, as opposed to a means to just monetize, what you see with corporate entities. So I think but in doing it, it's just an insurmountable amount of benefits. And of course, for the physician, it's it is financially very lucrative. So a lot of the revenue or the reimbursement extracted from a patient. Of course, in the outpatient setting, we go into the hospital, and then the huge money-making things, especially in cardiology, are procedures. So to remove that out, and then to add that as a revenue stream to your own practice is enormous. So there's a big financial incentive, but that's not the only reason to go into it. To go into it is actually because it's to provide better care.
All right, thank you. All very important points. You know, and on that same theme of, you know, patient care and empowerment of physicians, I'm going to circle back to Dr. Young. Some questions in regarding academics. Are you able to negotiate your own salary and benefits, or is there, how much flexibility is there in academics, would you say? And have you, and I'll add a second part to the question, have you faced any unique challenges as being a woman physician in academics? Because I know it's predominantly male dominated.
Sure, I think this has been a really great discussion, and I fully agree with everyone's comments about autonomy. And I will say that I made a very conscious decision to go to a community hospital, and I work for a community hospital, and I don't work for a large corporate entity or a large academic institution either, because when I looked at the job opportunities and what I could negotiate or not negotiate, or what my productivity goals were or were not, they are very, very different. So I'm totally in agreement with everyone else, and anything you can do to protect yourself and protect your autonomy is really important. So to answer the question, I did have some power to negotiate. I was able to negotiate exactly how much of my week is clinical time, how much of my week is precepting or supervising time, and how much of my week is administrative time, where I build my lectures and do all of that kind of work. And I did find that at larger institutions that I interviewed at, those things were still negotiable to a point, but less negotiable than I found at a community hospital. And certainly I do run the risk, like we've seen, as Dan was pointing out, there's been so much consolidation that, of course, I run the risk of that happening to me as well. But hopefully I've chosen well, and I'm going to do okay where I am. As far as unique challenges in being a woman physician, I personally don't have children, but I have several female colleagues who do have children, and I have seen that play out in not always a great way in the academic setting. It can be very challenging to get the time off that you want for maternity leaves or paternity leaves, as well as to negotiate the things that you need once you already have a child, when they get sick or those kinds of needs. And I will say on the flip side, and I'll leave it to others to comment who would know better, but I have heard on the flip side that being in private practice also comes with some of that, because you don't always have paid time off and those kinds of things. So I think there's probably pros and cons on both sides. The other challenge that I have run into somewhat is just that it is a very patriarchal and hierarchical thing in academics. And so sometimes it does take a little bit of extra effort, some extra time, some extra energy spent really proving that although I don't look like everyone else in the room, I do come with my own qualifications, and I do have the leadership or the whatever is needed to get things done. So I think that there is a little bit of probably a gender tax that I end up paying there, but to me it's worth it. But you gotta have a little bit of a thick skin to keep going.
Right, and hopefully, you know, some of those gender biases, as we learned about earlier today, will be shifting, because now there are more women coming out of medical school than before. But it's definitely a challenge, and you're absolutely right, whether you're in private or academics or in any setting. And so my next question actually was for Dr. Choi. So how difficult is it to open a practice? Because I know many who I've spoken to feel that it may seem like a daunting or overwhelming task. And I know you did it, you know, from scratch. So can you take us through some of the basic initial steps? You know, don't have to go into too many details, but just how do you start? Let's say someone decides today, okay, you know what, I want to take control of my career.
So absolutely. Thanks, Purvi. So I would say that starting a solo practice from the ground up is extremely challenging. And I think that it's not necessarily for everyone. It has its pros and cons. And everyone has their kind of own personal preference about what matters to them, right? What their value, what they're valuing, and what they want to take out of their job options. An employed physician job may be perfectly suited to you too. And I think the first step is really kind of assessing that and figuring out whether the pros and cons of being in private practice or solo practice really match your needs. I think that, the big pros obviously are what was discussed earlier, autonomy, but also in the biggest thing I've seen also for myself is financial stability, in the sense that, most medical students now are graduating with approximately, I think the number is about $200,000 in medical school debt. That seemed like a very staggering figure to me. It was overwhelming. It was the payment was like half of my mortgage payment every month. It was really just very burdensome. And really, when you're kind of in a position where you're at a capped fixed income, that can become stressful. And I think that adds to burnout. I think that one of the big pros of running a business is that there's really no cap on what you can do and what you can earn. But if you work, the motto we have in private practice is you kind of eat what you kill, right? So if you want to make more money and you want to pay off your loans faster, you can potentially design your practice to maximize revenues, see more patients, maximize clinical throughput in your office, and do more. For me, if I do more surgeries every month, well, my collections 3 months later will look bigger. And so from that standpoint, it's been that, independent practice, you have to look at healthcare, right? Because you see all these entities like private equity and Amazon trying to get into healthcare. I mean, everyone's trying to get into healthcare. Every big business is trying to get into healthcare. And you have to ask yourself, like, why is that? Like, if healthcare, if all these doctors are saying we're not making enough money or we can't pay off our student loans, but everyone else in the world seems to be in healthcare to make money, there's something like not adding up there, right? And I think for me, being in solo practice, I know exactly what I collect professionally for my surgeries, and the number is still pretty good. And if someone else was kind of, these other entities come in and they swoop in and they take your value and they're kind of skimming off the top to try to squeeze profits out, well, that's where we're missing out as physicians. So I think that's a huge incentive to think about, whether private practice is right for you. I think the cons of being in solo practice is that it is not a 9-to-5 job, and it can't be your first few years if you're going to establish your own practice. It is a lot of late nights, potentially weekends. You have to do what it takes to run your business. So you're going to see patients, you're going to do surgery, but on the side, you're going to have to run a business. You're basically the CEO, you're the administrator for a while until you get to the point where you can hire someone who might take care of those tasks for you. And, I'm kind of at that stage right now, but the first 2 years, it was very tough because I was the one kind of formulating everything, doing everything. And the challenge also is that in medical school, we get no formal training about how to run a business, how to write a business plan, and how to kind of run a business, right? How to hire people, how to fire employees, how to read a profit loss statement, how to work with an accountant, how to think about compliance, like how to make sure that your employees are compliant with laws in your state. So there's a lot to think about, and there's a lot to learn. I would say, if you think this path is for you, the best way to kind of get started is to talk to someone who is in private practice or in independent practice in your specialty. I think a lot of factors that dictate, how easily you can start your own practice has to do with it's specialty specific. Spinal surgery is done in the hospital. I don't need to buy an expensive laser or, any expensive equipment in my office to be able to provide care to my patients. So I actually had a pretty low barrier to entry because to start any business, you need capital, you need money to hire employees, you need to find a space, you need to lease a space. There's a lot of things that cost money. So there's a lot of startup costs at the beginning, and you need to assess that. And then the next step after that would be, formulating a business plan, and then presenting to a bank perhaps to get a starting loan. And so, I think all those starting steps can also be given to you by a colleague who's in private practice. Well, I think there are many out there who are willing to help you. I think some formal resources that I can point you in, and I will provide some links in the chat, is that the AMA has its own private practice physician section, which was actually recently founded about 2 years ago, because the AMA recognized that private practice dying in America was terrible for patients and patient access to care. So they're working hard to try to kind of revive private practice and protect its viability. And so that young graduates will also have more job options, right, after you graduate. And there is a podcast called Thriving in Private Practice that has many physicians who are owning practices talking about their experiences. And there's also a roadmap to starting your own practice as well, that it's a playbook that actually talks about all these things in detail that I just mentioned. So I will put those links in the chat, and that should hopefully point you in the right direction.
Thank you very much. And I know from hearing from different banks and stuff, they actually love lending to physicians. So I know the capital is often a big barrier to entry, but actually banks like lending to physicians for the same reason every other corporation is trying to get into healthcare. This is one of the most recession-proof jobs. Physicians are hardworking, they're reliable, they know doctors will pay off their loans. So make sure that you do talk to people, as Dr. Choi mentioned, before ruling something in or out. And then along the same lines, Dr. Lalani, I wanted to ask you kind of some practical aspects as well. How do you set yourself up as an independent contractor? Do you need to form a professional corporation or like an LLC? If you could talk to that a little bit.
Sure. So one of the great things about doing locums is that as a locum physician, for the same job, you're getting paid about 3 to 4 times as much. So since you're kind of coming in, picking up the shifts for someone that might have just quit or has gone for maternity leave, they're desperate to fill that spot. So they are paying you a lot more because you're able to just come in and do the work and be seamless at it. And the more you do it, the higher you can kind of negotiate your pay. The more desperate they are, the higher they're going to be paying you. And then, since now you're making a lot of income, one of the downsides is that, they don't provide you with insurance or retirement because you're no longer a W-2. But the upside is that you're a 1099. So what a 1099 tax way is that they don't provide you with insurance or, they don't contribute to your IRA, but at the same time, you get a lot of tax benefits. So everything is a tax deduction. So if I get my own health insurance, if I get my own, equipment, if I get anything, even clothes I buy, or, the food I buy, or the money I spend on travel or Uber, everything becomes a tax deduction. So the best way to kind of maximize these tax deductions is to either most of the taxes that are done under 1099 it's done as a sole proprietor. But to get more deductions, you can set up what they call PC, which is a private company, or an LLC. It's really important to have a good accountant that is familiar with people that do locums. I've tried a couple and I finally found a good one. So I currently have a PC. So the way it works is that, after I work my shift, I submit my timesheet, my company pays me. They don't take out any taxes. So one of the things that happens when I get this paycheck is that no taxes are taken out because I'm a 1099, as compared to a W-2 where taxes are automatically taken out based on the state you're in. So automatically, when I get my paycheck, I have to take some money out and put it aside for taxes. And then the way the PC works is that this payment goes to my private company, which is me. And then the way it works is that I give myself a salary through my private company. So for example, let's say if I make 100,000, my company gets paid 100,000 and it gives me 20,000 in salary. So the rest of my deductions, like let's say insurance, clothes, food I buy, transportation, things I had to buy for my job, stethoscope, whatever it is, I take that, I submit all that information for a tax deduction because I'm my own company and these are just tax deductions. So that payment comes out of the money that was given to my company. So it's a little confusing. It's one of those things, you know, you kind of have to do it to get more understanding of it. One, I've learned that it's a lot of things you have to research on your own. You have to talk to a lot of people that have done this. In medicine, we're not good at managing our money. They don't teach us how to do these taxes. They don't teach us what type of companies to open. So a lot of it is kind of learning a new language to better benefit you. So I found a really good accountant. You know, it's all about finding someone that is familiar with people that do independent contracting and can set up these things for you. So my accountant set up my private company or LLC, and they're the ones that kind of handle everything.
Yeah, that's a very good point and a lot of very good practical advice. It also reminds me of like a quote that I love that I think I say at every MSNY meeting from the ex-CEO of the Cleveland Clinic, where he says that, you know, even though many doctors may not have formal business training, it's a lot easier to teach a doctor business than a businessman medicine. And I think it echoes a lot of the points that all the panelists have made of how important that physician autonomy and physician-led care is, you know, so don't feel just intimidated, even if you don't know the business aspect of it, because just to become a physician, everyone has gone through so much, and this is the easy part, you know. So my next question is for Dr. Sraow. You know, you mentioned that you serve in many national leadership positions as well as regional. Did you find that it was difficult to be involved in these type of positions being in private practice? Because I think sometimes there's a misconception that if you choose, you know, academics versus private, that it excludes certain things. So what has your experience been?
So yes, actually, even if you didn't bring up that question, I was going to bring it up anyways, based on a lot of the discussion. So I think that I don't like the categorization of that, and this compartmentalization that goes into this like brainwashing of physicians, I would call it, that there's this huge like difference between an academic versus a private practice physician. And like depending on where you work, because if you're a hospital employee doesn't necessarily mean you're academic. And even if I've seen in many of the institutions I'm at that plenty of the physicians at Cleveland Clinic or Hofstra, North Shore School of Medicine, they functionally are the same as the private physicians that work just on clinical care. And alternatively, there's no reason why a private practice doctor couldn't get into academic endeavors. That's exactly why I chose my path, because what I realized, and I had great mentors, is that being a physician is a really special thing. So you have to actually look at yourself and realize that you're of tremendous value. And you actually are, like, both financially, but you have the capabilities of really molding yourself into anything that you want, because you're going to do well, you'll be financially stable. As you just mentioned, anyone who's smart enough to be a physician is overqualified to be a business person if they're just dedicated in like maybe 5% of their efforts. They'll be one of the best business people out there, actually, because that's the nature of how hard and how smart physicians are. So for me, I knew that I could mold myself into whatever I wanted, but I am very interested in research. I am very interested in academics. I'm very interested in administration, and I'm also interested in autonomy and clinical care. So how I was able to do that is, as I have my own company, so my own private practice, and we have other cardiologists that work with us as well. And that gave me freedom and flexibility to kind of mold myself into whatever I wanted. So I dedicated a little bit of my time to getting more involved in hospital administration. Initially, they needed a structural heart program. It wasn't created in the East Valley of Phoenix. So I put in all my efforts to create their program, and in doing so, learned a lot about the finances and budgeting and the fiscal years and all those things we have to do to put major programs together for a hospital system. And those kind of administrative skills of just taking one role on, it carries on to other roles. It makes you valuable in other things, and you eventually, if you're interested, find yourself needed in other aspects of administration of the entire department. That, to me, I had the opportunity to then be the national, just people recognize that I was interested, and they know that physicians, when interested, are capable of doing good things. So I was then able to go up and become a national chairman for Common Spirit, which is the largest nonprofit health system in the country. And I oversaw 123 programs. So this is like 700 health systems across 23 states. And that was another great thing, because then I got to get involved in business on a different level. It was contracts with major device companies like Medtronic, Boston Scientific, Edwards, about doing negotiations on a large scale for our whole health system. And just being part of that process, it was exciting and it was cool, and I got to learn a lot. So I think for me, it was just the recognizing that, especially if you're in a private practice model where you kind of have the freedom to mold yourself one way or the other, you don't have these benchmarks that you're constantly chasing. You can then dedicate yourself to things. And in terms of research, I'm very interested in that. So I'm the principal investigator on an international trial for heart valve replacement, and I'm the PI for Arizona. And you know, these are major trials. And how do I get to do that is because I'm just utilizing the research department of the healthcare system that I go to, because it's there. And if you want to get into research, they're not going to turn people away that have the enthusiasm. So just because you're in private practice doesn't mean that, hey, we don't want you. They'll say that they do, that if you express an interest, there's resources that you could use in all the hospitals, and inevitably will be, even as private practitioners, especially in cardiology, you just have to work with and deal with the hospital. So essentially, I think the easiest thing is just recognizing that as a physician, you can do whatever you want to do. And if you have a huge amount of debts and you're afraid of that, know that your power to erase those debts is pretty strong, because I mean, no matter what way you go, there is going to be like a pretty good financial lifestyle in terms of any physician in any field. So I think just embrace your capabilities of doing whatever you want and make it exactly what you want, and know that you can do it.
Great, very inspirational words. So I have obviously many more questions for the panelists, but I want to give a chance for others to ask questions as well. But I will kind of put this out to all of you to answer. You know, what advice do you have for new graduates or early career physicians? And would you do anything differently now looking back? You know, hindsight is always 20/20, and you know, all of us have benefited from advice from our mentors. So if you have any few parting words before I open it up for questions from the rest of the group.
I think that I would have two pieces of advice. One is kind of going to Dan's point just now, that you can do whatever you want to do. And it really doesn't even matter what specialty you choose. You can still do whatever it is that you want to do. So don't feel like you're locked into something. We are extremely well qualified, well-trained people that can make what we want out of it. The other thing that I would say is when I first started earning an attending salary, I could never figure out like where the money was going. Like I make a lot of money, but where the heck is it going? Because it doesn't feel like I'm making any progress here. And some of the best advice someone gave me that I work with was it takes a year or two to really start to get your feet under you. So whatever you can do to continue to live like a resident or a fellow, to get your feet under you, just do it for a couple more years, and it will make a huge difference in where you end up financially and how you feel on a day-to-day basis. Just going back to that autonomy question.
Thank you. Anyone else, any advice or anything that you would do differently?
So there was a question from George on the chat who said, what do you do to get over the fear of starting your own private practice or surgical center? So can you guys hear me? Am I on still?
Yes, yeah, we can hear you.
All right. So what I would say is, what we kind of alluded to is that there is, so this is, you have to accept that it's a business. So you're not just a physician, you're almost taking on 2 full-time jobs at the same time. And you have to be willing to really take that on, that you're going to be like, seriously, you're gonna be working at 200% capacity for some time, because you are running a business, and for the most part, no matter who you hire to help you, you're going to be the president or CEO of that business. And that is going to be time consuming, and it's going to be your baby. And you're really going to have to know about every single detail. So it's not for everyone, but the fear, I believe that, so what Purvi actually has a great quote that she's obviously didn't make up, but there's a paralysis by analysis, that if you sit and you think about every possible scenario, then you probably won't get anywhere. So my business method, and I did this because I was confident in the fact that, like Dr. Choi said, that if there wasn't so much money to be made, and in surgical centers, it's tens of millions of dollars of money to be made. It's not, and that's why private equity, corporatization, big corporates are going into even buying surgical centers and trying to start those. So the money is there, and so sometimes you just have to jump in, and you troubleshoot as you go along. They're for a surgical center, more so than a private practice, that you have to be possibly ready or planned to take a lot of capital loss at the beginning. So you have to withstand a lot of gut punches, a lot of them unexpected. But you kind of, when you start getting your contracts and you start getting paid, I mean, you're just, first time you start getting paid for procedures directly, you're just shocked. You're like, my goodness, I cannot believe that this is what it costs. So that fear and anxiety kind of goes away pretty quick. And really, before you start, you'd have your Medicare contract, and then you start getting those, and then you're at least treading water with that. And then as more things come, it's just icing on the cake. So you just go in with the mentality that it's not easy. So no matter what you choose, or whether you're a billionaire or millionaire, there's one factor and variable that's unanimous amongst all of them, and that it's a serious amount of hard work that you put into it, whether you're any successful business person. So just go in there and you be ready to hustle, be ready for the long haul, and then you'll get the benefits. So I think when you see the financial benefits are a big driver, but you'll see your patients happier as well. But from a straight business standpoint, the light at the end of the tunnel is a lot of money. So that can alleviate a lot of fears. I hope I answered your question.
I can comment too as well. Dan, I think you made some great points there that I 100% agree with. I have to tell you, having my own practice financially, it was, it's life-changing kind of, difference, in terms of controlling my own, destiny, in terms of, what I was getting capped at previously by my employer, to kind of seeing my own collections has been completely changed my life. So, and my family's life, and our kind of future direction. And I think that, there's a lot of unknown, but I would tell anyone who's really interested in this, starting your own practice or, anything is that you just lean on the same skill sets that drove you and how everyone here in this room actually figured out how to get through pre-med, medical school, residency. There was a ton of knowledge here that you had to kind of gain. And I got to tell you, like learning about how to run an EHR or like how to talk to your accountant or what things you need to talk to your accountant is actually like way easier and way more fun to learn about than organic chemistry or I don't know, pathophysiology of cardiac pathophysiology. Sorry, Dan, like I think for me, it's way easier. And so you guys are all really good at learning new things. Like this is a skill and a talent that you've honed, and you're probably the best test takers, right, in your class, and you know how to absorb large amounts of information and make it useful. So for anyone to say like, oh, well, doctors are just really bad at business, I think that's like a stereotype that is so easily overcome if you just want to. If you are motivated to and you want to overcome that, it's so easy to do it because you're already really good at figuring out how to do new things, in my opinion. So I hope you could take comfort in that. And I think that sure, like medical school, residency, and fellowship, it's kind of like very structured, right? It's given to you, and it's kind of in a way, like all the hard work is served to you on a platter in some way. I think you have to be okay with uncertainty. That's something that in medicine in general is pretty prevalent, right? When we diagnose and treat our patients, so much uncertainty. There's uncertainty in running your business. You don't know what's going to happen next year. You don't know if there's another COVID happening. I think that you have to learn and develop this instinct to tolerate calculated risk, right? Which is, there's, kind of money in to start something and kind of looking into the future and seeing what, my investment in this, what is it going to bring for me in the future? So being able to tolerate and have tolerate calculated risk is a big thing. And then I think, developing, networks is like the biggest, way to kind of alleviate fear and like kind of difficulty in doing this, which is, I think that my networks have brought me way more than any kind of reading I would do of like some entrepreneurial guide or anything like that. It's really going out there and being able to, talk to this person. Like you ask yourself, what do I need to accomplish ABC in the next 3 months? I don't know how to do A, B, or C. Maybe there's no book on this. There's no YouTube channel on it, but, I've met someone, maybe you met me through this Zoom call and, or Dan, and you guys want to reach out to us. We're available to any of you who want to talk about certain questions about how to start your own practice, and talking to those people and developing a network and trying to, form relationships to help you accomplish those goals. I think is the biggest force multiplier for me in running my practice.
Can I add to that one thing? Because I loved what you said, and I loved everything everyone said, but I really dislike that stereotype that physicians are bad business people. You hear it all the time, but it's always strategically from those people that stand to gain from physicians believing that. So you'll hear it from private equity, and you'll hear it a lot from the non-doctors, the ones skimming the icing off the cake. So this is really a strategy to rein in the immense power that physicians have when they are in control of their own product. Because so if you look at it as the healthcare system as a financial entity, the product that is being consumed, delivered, and sold is really being created by the physicians. So to give physicians control of that product is immense power. So that is scary to those people that stand to make like significantly more money off of the product we're creating by basically either just packaging it in a different way or just essentially controlling it. So I think that is a tool to just tell every physician that they're incapable of being a business person, and it's flat out like wrong, also should be insulting. So sorry, I've been taking so much time.
Great. Yeah, those are excellent points. I think there might be a question in the question box, but I can't see it for some reason. Can anybody, I don't want to miss any question. But yeah, I absolutely agree. And to echo a lot of the points everybody made, that you can really make your career however you want. You can be as involved or in anything. I don't think I properly introduced myself. I'm always also in private practice, but I got to be involved in the vaccine trials during the COVID pandemic. So you can kind of mold your future and your destiny, and it's really not as daunting as it seems. I just wanted to see if there was any other questions from anybody else.
I had a quick question, if we have enough time. Can the panel, can they kind of elaborate what they believe differences or between rather than starting your own private practice, but being employed by a private practice versus being employed by a hospital system, if they feel those are similar or different in any way?
I'll comment briefly. I have to jump off this call. I'm so sorry, guys. But I do think that the biggest difference is that a health system, when you get employed, even when you're coming right out of practice, when you're coming right out of training, if you're thinking you want to do private practice, you're going to get an employment contract from a private practice, and typically that employment contract will have some type of profit sharing or partnership tract in the contract, that after you work in that private practice for like 3 years, you will have like partner status in the practice, and that will allow you to make decisions within the practice, as well as take in like profits, right? They split up the profits and you get that at the end of the year. That doesn't really exist with health system employment, right? Health system employment, there's no ownership you're ever going to have in the hospital. And remember, ownership is a big deal, because ownership is something that it's equity, right? You are actually growing the value of a practice as you also earn income through it, right? You're earning income, but then as that income has, you're a business entity. So now you can give a valuation to your practice. And so you're basically like growing your nest egg as you become a partner in a practice. And that is not necessarily given to you. Your starting salary and your bonuses may be higher in a health system, but that equity component is really not offered in those options. I have to run. It was great seeing everyone here on this call. I hope that was helpful.
All right, thank you. So we're right. I personally could talk to all four of you about this for hours, but I just wanted to thank all of the panelists. Thank you so much for everything that you do for your patients. And I know I personally learn so much from all of you on a regular basis. So I just want to put it out there to everybody also on the call. If you have more questions for the panelists, please, we will get them answered. So you can feel free to email them in and we will get them answered. I know we never have enough time. So with that, I just want to thank everyone for a great meeting, especially James. He put most of this together. Kathleen, thank you so much for keeping us organized and on track. And then I'll hand it back over to Dr. James Doherty too, in case he has any last minute things. And residents, fellows, please stay on for the business meeting. But thank you, everyone.